Welcome to the Maternity Mentor. Today we will be talking about the top 10 symptoms of early pregnancy. Stay with us. Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner, and I have over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Many women wonder if they may be pregnant, but they aren't sure what signs to look out for. Let's explore the top 10 symptoms you may experience early in your pregnancy. Whether you are actively trying to get pregnant or pregnancy might be a surprise, most women want to know what the early signs of pregnancy might be. Unfortunately, every woman is different, and even every pregnancy they experience will be different, which makes it challenging to notice early pregnancy symptoms. Some women will experience symptoms while they are still getting their period, and others won't experience any symptoms until well into the first trimester. Some women may have no symptoms from our list, others may have one or two, and some will have every symptom on this list. If you think that you might be pregnant, be sure to start taking a prenatal vitamin immediately if you aren't doing so already. Also, stop drinking alcohol immediately to prevent complications with the baby. If you suspect pregnancy, you can purchase a pregnancy test in your local store, which are now sensitive enough to pick up pregnancy after just a few weeks. If you are pregnant and these symptoms are bothersome, speak with your healthcare provider because they may be able to assist you with them. Now let's explore the top 10 early symptoms of pregnancy. The first early symptom of pregnancy is nausea or morning sickness. The cause remains unknown, but it occurs in 50 to 80% of all pregnancies. Nausea can occur at any time of day or night and may be associated with vomiting. It is believed hormonal changes may contribute to these symptoms, as well as the cravings women will get during their pregnancy. It usually starts around week 6 and will peak between weeks 9 and 11. Luckily, most nausea will completely resolve between weeks 14 and 20. Next up is fatigue or feeling very tired. This is very normal during pregnancy and can start as early as 1 week after conception. There are two main reasons for fatigue during pregnancy. The first reason for fatigue is the high levels of progesterone that are a normal part of pregnancy. These high levels lower blood pressure and blood sugar levels. High progesterone levels also help boost blood production. All of these effects can lead to fatigue. To help combat your fatigue, make sure to rest often and eat a healthy diet rich in iron and protein, which can help boost energy and counteract your tiredness. The other reason for fatigue is that you are growing a human being who is using a lot of your nutrients and resources in the first few weeks due to rapid development that is taking place. Anyone is bound to be tired after all this. Before we continue, please remember to hit that like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about breast tenderness. Another early sign of pregnancy is swollen, tingly, or sore breasts. This can occur within a few days of conception due to the rapidly rising hormone levels. Breasts may also start to feel heavier and look fuller and may even feel slightly warm to the touch. Additionally, the areola, which is the area around your nipple, may start to darken. These symptoms are all in preparation for beginning breast milk production for the coming baby. Our next early symptom of pregnancy is missing your period. This may be the most obvious sign of pregnancy. Your period stops so that the fertilized egg can implant into the uterine wall. The uterine wall then serves to nourish the baby through blood exchange via the placenta. It is important to be aware that some women can become pregnant and still have their period for 1 or 2 more cycles, making it important to take a pregnancy test if other symptoms are present. Next up is changes to your bathroom habits. In the early stages of pregnancy, it is very common for women to experience frequent urination. This usually starts between 6 to 8 weeks of pregnancy due to hormonal changes and the increased blood volume required to support your pregnancy. It's important to check in with your healthcare provider if you start to experience this, because it could be a sign of a urinary tract infection, which should be treated immediately. Another change to your bathroom habits may be the development of constipation. Constipation is caused by the increased progesterone levels, which slow down the passage of food in the intestines. Exercise, drinking plenty of water, and eating a high-fiber diet can help prevent constipation from occurring. Another early sign of pregnancy is bloating and gas. These signs are also associated with the hormonal changes that occur with your pregnancy. The increases in progesterone are needed to help relax the muscles in the pelvis to allow for the growth of the baby. However, as previously mentioned, the increase in progesterone slows down the intestines significantly. This increases not only the passage of gas, but also the trapping of gas in the intestines, leading to a bloated feeling. One of the more bothersome signs of early pregnancy are mild headaches and backaches. Lower backaches are very common during pregnancy and often one of the first symptoms a woman may notice. They can start within the first few weeks of pregnancy, but may also appear later due to the growing size and weight of your baby. Headaches can also start early in pregnancy. They are caused by the rapid increase in pregnancy hormones as well as the increases in blood flow throughout your body. Our next early symptom of pregnancy are sensory changes to smell and sight. Pregnancy increases your sense of smell dramatically, and one of the first symptoms many women will report is a change in smell. This is probably due to the increased blood flow to the nose. For many women, however, sensitive smell has the drawback of adding to nausea and food aversions. Many women will also report blurry vision early on in pregnancy. This is caused by the changing hormones a woman will experience. It is very important to remember that blurry vision after your 20th week of pregnancy is not normal and could indicate a medical emergency. Be sure to let your healthcare provider know if you have any blurry vision. Our next early symptom of pregnancy is spotting. Within 10 to 14 days after conception, the fertilized egg will attach to the lining of the uterus. When this happens, some light bleeding may be seen, which is called implantation bleeding. Implantation bleeding often occurs at the same time as the next menstrual period would be, so many women will not realize they are experiencing it. Our last symptom in early pregnancy are mood swings. Pregnant women have frequent mood swings due to hormonal changes. These changes affect the neurotransmitters in the brain, causing women to experience emotional highs and lows. Sleep disturbances caused by waking in the middle of the night to use the bathroom or due to aches and pains can also contribute to these mood swings. While these mood swings are normal, if you remain depressed or anxious for too long, you want to speak with your healthcare provider. Many women will benefit with speaking with a mental health counselor to help cope with these changes. Pregnancy is a very exciting time in your life. I hope this has explained some of the early symptoms you can look for to see if you are pregnant. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.